Now, India continues to battle the coronavirus outbreak there as the number of active cases now mount to 89 in a bid to give in efforts to the virus here. United efforts. Prime Minister Modi will speak to SAARC heads of states via video conferencing to chart out a roadmap to fight the novel coronavirus. With 2 deaths and confirmed cases on the rise, Centre has said that the outbreak will be treated as a notified disaster to provide aid to states under Disaster Response Fund. States are taking all precautions after closing theatres. Now, Maharashtra government has also announced a closure of malls until the 31st of March, after which cases in the state rose to 26. Just yesterday, West Bengal, Goa announced closure of schools across the state for a month. Clubs and casinos have also been shut in Goa. This after the Delhi, UP, Bihar, Madhya Pradesh, Kerala and Chhattisgarh governments announced closure of malls, cinema halls, schools and colleges for a week.
Cinemas closed, shopping malls deserted, public places sanitized. With over 80 cases, India is putting up a tough fight against the coronavirus. In a bid to reduce public gatherings, states have taken rigorous steps. Cinema halls have been shut in over 5 states, including Maharashtra, Delhi, Punjab and Odisha.
I'm standing here at a prominent cinema hall in Connaught Place, which would otherwise on a weekend is usually bustling with crowd. But as you can see here, this cinema hall is now shut. In fact, most of the moviegoers said that they would have loved to go ahead and watch a movie this weekend, but because of these orders, which are precautionary and preventive orders by the Delhi government, they have not been able to do so. In fact, a lot of movies, the release of a lot of movies has also been postponed, keeping the coronavirus in mind.
Malls in metro cities are also deserted, despite it being a weekend.
Love for cinema is one factor that can define a Chennaiite. But what we are seeing here in Chennai now because of coronavirus is that people have reduced coming to theatres. We are outside one of the most famous theatre complexes in Chennai, and today you can see that it has a deserted side. There are not many people in this place. Very, very few moviegoers have come up today, and in fact the officials who were there inside the theatre have also said that the number of people who have come to watch the movies have significantly reduced.
I'm coming to you from one of Bangalore's biggest mall. As you can see here, the notice has been put up that the mall is closed till further order. Yesterday we saw the Chief Minister and the government announcing that malls, shopping complexes, exhibitions, cinema theatres, multiplexes, everything will be shut due to the spread of coronavirus for 1 week starting from today. This place is completely full of people, but today it has a deserted look with no one here except for few security guards.
The Karnataka government has also cancelled leave of all doctors and health department staff. Business has also been badly hit in Mumbai.
Most of the shops around are open. Some are saying that the business has been hurt, but quite a few saying that it's still carrying on the way it used to earlier. And right here in Matunga, we can see most people here walking without masks, freely doing their work that probably they had planned on a weekend.
Assam Chief Minister Sarbanand Sonowal has decided not to appear at public events till March 31st due to the coronavirus scare. As the battle against the deadly coronavirus continues, state governments and administration are leaving no stone unturned to contain the pandemic. Bureau Report, India Today.
Now, India has recorded its second coronavirus death. A 68-year-old woman died at the Delhi's Ram Manohar Lohia hospital after being infected by her son who had travelled abroad. The victim's final rites were carried out in Delhi after being initially denied by the crematorium. Here's more.
In the ongoing battle against the novel coronavirus, India recorded its second death. A 68-year-old woman died of COVID-19 virus at Delhi's Ram Manohar Lohia hospital. The victim was infected from her son who had travelled to Italy and Switzerland and returned to India on the 23rd of February. She was also suffering from diabetes and hypertension. But the grief for her family did not end there. The victim's family was initially denied permission for the funeral by the cremation ground, fearing spread of the virus. The last rites of the victim were later carried out at the Nigambodh Ghat. Delhi Health Minister later clarified to avoid a repeat of this incident.
किसी भी तरह से अंतिम संस्कार करने से कोई भी रिस्क नहीं है किसी को भी. इस कंफ्यूजन को बिल्कुल क्लियर होना चाहिए कि लोगों को डर लगता है कि इसको जलाएंगे तो हवा में फैल जाएगा. हवा में बिल्कुल नहीं फैलता है. आप जब छींकते हैं या खांसते हैं तो आपके जो वायरस हैं आपके ड्रॉपलेट्स में साथ में होते हैं. अगर बहुत बहुत पास में है उसके बाद डायरेक्टली इसके मुंह पे लगता है तब हो सकता है.
Delhi government has also announced a slew of measures to prevent the spread of the virus. Schools, colleges, cinema halls have been shut till the 31st of March. IPL and sporting gatherings and conferences have also been prohibited.
Questions are being raised as to what exactly is the protocol for such deaths and how their cremation or burial should be done in such a case. With Kuldeep, this is Milan Sharma for India Today.
Now, unfortunately, the wife of a coronavirus infected Google employee there who had escaped from Bengaluru after testing positive for the disease has now been found in Agra. The couple had recently returned from her honeymoon in Italy. Her husband, a Google employee, had tested coronavirus positive. She was also kept in isolation, and after developing symptoms and then tested positive, she managed to escape. However, the woman escaped Bengaluru on the 8th of March and flew to Delhi by air. Then she took a train to meet her parents in Agra, where she was finally found. The health authorities in Agra, meanwhile, have isolated her family members now and have sent the woman's samples yet again for testing. They're all under surveillance now. In fact, their tests have been sent to Pune. They're waiting the results there. The district magistrate, in the meanwhile, of Agra there have said that the woman's family is really not cooperating with the government and that they will take strict action for non-cooperation there. Meanwhile, Agra railway authorities along with district administration have already started sanitizing the railway station and the coach that she came in, but it's going to be quite a tough task for them.
अगर किसी के एक्ट से इस वायरस के स्प्रेड होने में अगर उसमें गति मिलती है तो डेफिनेटली उनके खिलाफ कार्रवाई की जाएगी. इस केस में हमें इस फैमिली से पहली बार सहयोग नहीं मिला, चाहे ये लेडी हो या इनके पिता हो. एक भ्रामक सूचना दी गई कि साहब ये दिल्ली के लिए निकल गए हैं और हम लोग दिल्ली को अलर्ट करना पड़ा. जब कुछ लगा कुछ गड़बड़ है हमने चेक कराया तो पता लगा वो वहीं आगरा में अभी हैं. फिर अलग से डेडिकेटेड टीम गई, सीएमओ साहब गए, ऑलरेडी डॉक्टर पारिक थे वहाँ पे. फिर उनको लेकर के उनको आइसोलेशन वार्ड में ले गया गया, उनकी फैमिली को जिला अस्पताल लेकर के आया गया. और लगातार गलत सूचना देना, झूठी सूचना देना, यह बिल्कुल ही ठीक नहीं है.
Now, as coronavirus cases mounts, let's take a listen to experts. All you need to know how to fight COVID-19. India Today's Rajdeep spoke with experts. Take a listen.
Mumbai is a city which perhaps uses public transport, the trains that are the lifeline of the city. Should we be closing down trains also in Mumbai? Dr. Parikh, some will say if you're closing down malls, find a way in which even public transport is controlled.
Okay, if you'll permit me,
Yes.
preamble to that answer.
Yes.
And in the context of what was said earlier, because this may be the most important thing that we need to understand. We've been talking numbers. I repeatedly hear 84 cases positive in a massive population. That shouldn't be of concern. But as was pointed out earlier, you can only have positivity amongst the people you test. So I'd like to focus on this visual that has been prepared so that we can understand these numbers and the problem that we are facing or about to face in an appropriate context. On the right, the pink circles represent populations of countries. Right here on the left, the gray circles represent the numbers of people tested per capita.
Right.
This is India. This circle represents the population of India, and relative to that, this tiny dot represents the number of people tested. Approximately 6,000 people tested for our population. The 84 that turn out positive are only a subset of the people who have been tested, and the rest have not been tested.
Right.
As opposed to that, now look at South Korea. Here is the population of South Korea. Here is the per capita testing of South Korea. South Korea is testing over 10,000 people every day. That's almost twice as much as what India has tested so far. And, you know, we started with the optics of Donald Trump and the amount of money that the US has sanctioned. Well, they're performing as abysmally, far more abysmally than us. So this one on top is the population of the United States.
Right.
This is the number of people. This tiny dot here, no bigger than our dot, is the number of people they have tested. The model we need to follow is not that of the United States, but that of South Korea.
I
to repeat
take
again,
that point.
you can only find people positive.
Right. If
Pardon?
you test them. You're saying you can only find people positive if you test them. The point that Professor Lakshmi Narayan made. I think we're going to use that. We're going to take your chart, borrow it after the show is over and put it. I think people need to realize that we are not even testing a fraction of what tiny South Korea is. I just want to understand the one thing, Dr. Parikh, and you feel free, Professor, to join in. I just got on Twitter saying that South Korea has a 10-minute test, at the end of which they give you a text message after a day telling you your situation. Do you advocate this 10-minute test that the South Koreans are doing when they are testing 10,000 people a day? Is that what you're suggesting for India? This so-called rapid test?
No, not necessarily. Not necessarily. We need to do what is appropriate, what is cost-effective in India. But let me just complete. It's just a sentence over the South Korean model. South Korea, through its testing system, has brought down the daily infected new cases from 1,000 to just over 200 a day. And my next graph will tell you the significance of that. China, late in the act, but acting dramatically, has now brought down its daily new positive patients to again around the same number, 200. Chinese researchers are finding it difficult to find new patients for clinical trials. Now, here is why testing becomes significantly important. If you look at this graph, this axis, the x-axis, represents the number of cases. The y-axis represents the number of people, time and number of people. And this dotted line here is the healthcare capacity of our country. There are not very precise, but fairly good, robust mathematical models which have stood up to what is happening in other countries, and there's no reason why they won't apply to our country. And those mathematical models indicate that 20% of our country will get infected, not necessarily seriously, moderately, mildly, but keep in mind, even mild patients can transmit the virus. Now, that means if 1% of these people become severe and need ICU treatment, that's 1.5 million ICU beds. Our capacity today is 100,000. Can we increase capacity? Obviously not. But there is something we can do, and I want to emphasize that. And I want to thank my co-authors on the book that Penguin is bringing out now on the co-virus, Dr. Swapnil Parikh and Mahira Desai, for the research, the data, and this graphic. Look at this red curve over here. This is the number of cases in a short span of time. They go above our existing capacity and they overwhelm the system. You have a lot of deaths. Now, here is what is called flattening the curve. You have the same number of cases, but distributed over a longer period of time. And when you distribute this over a longer period of time, you get a graph, the blue graph over here, which goes below the dotted line or just about touches it. And that helps in containing the problem. We are now way beyond the stage where, we can hope that the weather will change and something else is going to work. That's wishful thinking.
Dr. Parikh, you're
hitting a situation, we need to know how to contain it.
Now, we heard what the experts had to say. COVID-19 continues to spread across the world as over 150,000 cases have now been reported worldwide, with over 5,800 deaths. France has been battling the virus with over 3,600 cases and 79 deaths, appears to be lax in terms of its fight. India today visited tourist spots in Paris, and it was almost quite a sad state of affairs there. The tourist spots were visited by most people frequently, and here we're looking at reduced crowds, people maintaining safe distance to curb the spread. It's only now that the government has really started putting in curbs on tourist locations. It seems like it's too late in the day, but better now than late.
इस वक्त मैं फ्रांस की राजधानी पेरिस में मौजूद हूँ, एक ऐसे वक्त में जब पूरे विश्व में कोरोना वायरस को लेकर डर व्याप्त है। वर्ल्ड हेल्थ ऑर्गेनाइजेशन ने इसे ग्लोबल पैंडेमिक घोषित कर दिया है। तो पेरिस में अलग-अलग टूरिस्ट डेस्टिनेशंस का मैंने जायजा लिया। आपको ये जानकर हैरानी हो जाएगी कि चाहे आइकॉनिक आईफल टावर हो या फिर लूव्र म्यूजियम हो या फिर डिज्नीलैंड क्यों ना हो, ग्राउंड जीरो पर कोई भी गाइडलाइंस, रूल्स एंड रेगुलेशंस या हिदायतें नहीं है। शहर भर में चुनिंदा लोग ऐसे होंगे जिनको मैंने देखा है जिन्होंने चेहरे पर मास्क लगाया होगा। यानी अलग अलग इलाकों पर जिस तरीके की आप उम्मीद करेंगे कि हिदायतें हों, गाइडलाइंस हों, वैसी ग्राउंड जीरो पर बिल्कुल भी नहीं है। लूव्र म्यूजियम में तो अधिकारियों ने कह दिया है कि टूरिस्ट को सेल्फ डिसिप्लिन करना पड़ेगा, उन्हें बताने कोई नहीं आएगा कि क्या करना है क्या नहीं करना है। डिज्नीलैंड में हजारों की संख्या में लोग मौजूद थे, लेकिन क्या करना है क्या नहीं करना है, किस चीज़ से बचना है, ये बताने वाला कोई भी नहीं। शहर के अलग अलग हिस्सों में ना तो मुझे कहीं छपी हुई गाइडलाइंस दिखी, ना ही कहीं भी छपे हुए डूज एंड डोंट्स की लिस्ट नजर आई। ग्राउंड जीरो की पेरिस से ये हकीकत है। पंकज उपाध्याय, पेरिस। इस वक्त मैं पेरिस के CDG यानी चार्ल्स द गॉल एयरपोर्ट पे मौजूद हूँ। एयरपोर्ट पे मानो सन्नाटा सा पसरा हुआ है। यात्रियों की संख्या बहुत कम है और जो काउंटर्स हैं वहाँ पर कोई भी यात्री नज़र नहीं आते। एक आध काउंटर्स हैं जहाँ पर यात्रियों की संख्या दिखती है, उनके चेहरे पर वापस अपने घरों को जाने की बेचैनी साफ देखी जा सकती है। कई स्टूडेंट्स से जो यहाँ पर हैं, मेरी उनसे बात हुई है और उनका ये कहना है कि स्कूल एडमिनिस्ट्रेशन ने अब जाके उन्हें घर जाने की अनुमति दी है। फ्रांस का पड़ोसी देश इटली, जिसने 15 से 20 दिन पहले ही जो कार्रवाई करनी शुरू करी थी, शायद फ्रांस अब शुरू कर रहा है। यानी उसके अलग अलग जो टूरिस्ट डेस्टिनेशंस हैं उसे वो अब बंद करना शुरू कर रहा है। ये सब देखते हुए एक ही ख्याल जहन में आता है और वो ये कि कोरोना वायरस से लड़ने के लिए फ्रांस ने जो कदम उठाए हैं उसमें उसने थोड़ी देरी तो नहीं कर दी। पंकज उपाध्याय, पेरिस। It's business as usual in the streets of Paris. इस वक्त मैं फेमस आर्क द ट्रायम्फ के सामने मौजूद हूँ और काफ़ी संख्या में यहाँ पर टूरिस्ट मौजूद हैं। शहर की रौनक इस वक्त देखते ही बनती है। ऐसा नहीं है कि ट्रैफिक की आवाजाही कम हो गई है, लोग घरों से कम निकल रहे हैं या टूरिस्ट यहाँ पर नज़र नहीं आ रहे हैं या होटल्स कैफ़ेज़ बंद हो गए हैं, ऐसा कुछ भी नहीं है। अच्छी खासी रौनक बनी हुई है पूरे टाउन में। यहाँ पर गलियाँ जगमगाई हुई हैं, टूरिस्ट भारी संख्या में यहाँ पर देखे जा सकते हैं, चाहे वो कैफ़ेज़ हैं, रेस्टोरेंट्स हैं, होटल्स हैं या बाकी दुकानें हैं। यहाँ पर अच्छी खासी भीड़ और रौनक इनमें बनी हुई है। ऐसा नहीं है कि लोगों ने आना छोड़ दिया है या कम आ रहे हैं या किसी की बात का डर किसी में हो। लेकिन हाँ, हैरानी की बात मुझे बस ये यहाँ लग रही है यहाँ पर कि हिदायत, गाइडलाइंस कहीं भी कुछ नहीं है। मास्क अगर किसी ने पहना हो ऐसा तो मुझे कोई नज़र नहीं आया। और सबसे बड़ा आश्चर्य पेरिस की स्ट्रीट्स में यही है, सब आम जिंदगी सामान्य तरीके से चल रही है, लोगों में डर तो बिल्कुल नजर नहीं आता। पंकज उपाध्याय, पेरिस।
Now, even as the world continues its battle against coronavirus, India today gets you the special report from Massachusetts, where the number of positive cases have risen to now 100. Mental health therapist Michelle Chawla spoke to us about fear, anxiety, paranoia around coronavirus outbreak and how to really deal with it. Take a listen.
Avoid contact is to do the elbow shake. Thank you so much, Dr. Kumar.
Beyond elbow bumps and namaste, mental health therapist in Massachusetts, Michelle Chawla is dealing with real anxiety about the coronavirus scare in the United States.
As a therapist, seeing clients the last couple of weeks, I've noticed an increase in anxiety, fear, paranoia, and just increased depression. Folks are worried and are not sure. Some may not have the facts.
She explains the mental condition of her clients as she walks into a family restaurant, now deserted because of the virus scare.
Nina, what are some of the changes you're seeing in this probably a 2-week period where the virus has really become more prevalent?
As everybody is getting aware of coronavirus, people are scared to come out now. The business is dead. Yes, it's affecting our business very much. We are feeling that the customers who used to be regularly coming all these weekends, finding difficult to come out and enjoy their food here. We've been cleaning the restaurant thrice a day. The vacuum has been done. All the tables have been cleared, cleaned. Changing of the napkins has been done twice. And all the staff is wearing gloves. Sanitation has been done everywhere.
Medical practitioners in the area are cautious. Dr. Amit Kumar explains the situation.
The most important precautions which we should take is to avoid your exposure to people who are sick, who have flu-like symptoms, and the other important things are washing your hands frequently, sanitization, and avoiding being in a crowd, avoid travel to areas where there are mostly coronavirus infection cases are found.
Massachusetts in the United States has till now recorded more than 100 cases of coronavirus. Anxiety is palpable. Bureau Report, India Today.
Now, coronavirus outbreak has had repercussions on the sporting arena. Even as IPL now remains suspended till April 15th, the possibility of a truncated season has not been ruled out, as the IPL governing council there discussed on ways to hold the tournament provided the coronavirus outbreak eases in days to come. The IPL was scheduled to start on the 29th of March, but the BCCI decided to suspend the season until the 15th of April. All franchise owners met the top brass of the BCCI and the IPL governing council in Mumbai to discuss further action.
Yes, we met with them to tell them what is the situation, how it can happen and how it can go, where do we stand at the moment, but at the moment it is just postponed. April 15th, in any case, 15 days are gone, so it has to be a truncated one. How truncated, how many games, I can't say at the moment.
So really, what are the options that the BCCI is now looking at? Let's take a quick look at what options they have in hand. So considering the situation does improve, the IPL can begin post April 15th, and the cutoff date for the start of the season will be May 1st. The final of the season is now scheduled on May 24th, and the BCCI can extend it up to the 10th of June. And the reduction in days will indeed result in more trouble there for the franchise owners, undoubtedly.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.